Hi, everybody. My name is Abby Silfies, and I'm the Executive Director of the American Heart Association in Lehigh and Berks counties. Today, I bring to you another conversation from the Red Couch. We haven't been with you in a while, and we have so much to update you on. And today, I have a very esteemed special guest. Dr. Singh practices with the Lehigh Valley Heart Institute at Lehigh Valley Health Network and is a native to the Lehigh Valley. As an interventional cardiologist, Dr. Singh routinely cares for patients with emergent blockages in their arteries, more commonly known as a heart attack. In addition, Dr. Singh has a clinical interest and expertise in peripheral vascular or peripheral artery disease. And see, that is why I am not the medical professional on here. We'll let you correct all of my grammar mistakes, but Dr. Singh is passionate about educating our community about heart disease and evidence-based treatment options. I am so looking forward to sitting here today and having a great conversation with Dr. Singh, and I'll let him go into a little bit more about who he is and why he decided to join us today. Welcome, Dr. Singh.
Thank you, Abby. Thanks for the opportunity to join you today. I think what the AHA is doing is wonderful. And so again, thank you for allowing me to share some time with you guys today. I am a board certified interventional cardiologist. I specialize in treating heart blockages, blockages in the legs, and also structural heart interventions. I joined Lehigh Valley Heart Institute almost 2 years ago, and I'm a native of the Lehigh Valley, as you said. I've worked on numerous projects around the community to help educate our community about heart disease and the different available therapies that we offer at the Lehigh Valley Heart Institute.
I had read a quote that you had given us, and I thought it was fantastic. And so now I'm going to quote you while you're staring at me. So it's always fabulous, right? But I read that you said that as a native of the Lehigh Valley, that you're eager to leverage your expertise to give back to our community that fostered your growth. Having family and friends in this area made you more passionate about educating not only the patients and their families, but also our entire community. And those words just really resonated with me. I'm a mom and I have 5 daughters that are being raised in this community, and I care so much about our community. So I just wanted to tell you how much I really have an affinity for you and the work that you're doing because of your dedication to the Lehigh Valley. So that's really special.
Thank you, Abby. Yeah, it's been a really nice transition after years of training to get to this point, to be able to come back home where I was born and raised, and I was actually born in Lehigh Valley Hospital. So it's full circle for me to be able to help all the people that were involved in allowing me to get to this point. So it's actually a real honor to be able to be on the front line with really treating sick patients in the Lehigh Valley.
Well, I love that. And so today, I really want us to focus on 2 specific parts of your body of work. So 2 specific cardiac emergencies. We at the AHA talk a lot about educating people in the difference between cardiac arrest and heart attacks. So we're going to jump right into educating this community that we both know and love. Can you explain to us what cardiac arrest is and what the chain of survival consists of?
Absolutely. Cardiac arrest is a sudden loss of responsiveness when the heart actually stops working completely. So as you know, the heart is a pump. It's responsible for pumping blood to the rest of the body to allow all the organ systems to work effectively. Cardiac arrest is cessation of heart function. And that can happen due to a variety of factors. One really important initiative that the AHA has done is they've mandated and updated over the last many years the chain of survival on how we need to approach helping people in this emergent life-threatening situation. The chain of survival really is for not only people in the medical community, but also people at home or out in the community when they see somebody who abruptly loses consciousness and or may stop breathing. The first, number one, important thing to do is to really understand that this is a life-threatening emergency, and to make sure the area and the scene of where this is happening is safe. Number two is to reach out and first get help by either calling 911 or having somebody else that's there call 911 while you attend to the person. The next thing is really to start high quality cardiopulmonary resuscitation, which is CPR. That is chest compressions on the center of the chest at a rate of 100 to 120 chest compressions per minute. That usually we like to say about 2 inches in depth to actually provide high quality CPR. What you're able to do in this life-saving moment is help circulate the blood throughout the body while the heart isn't working. That's what chest compressions do, to provide all the organ systems with the same pumping ability that the heart usually does, but is not doing because of cardiac arrest. Finally, the next thing to do is to get your hands on a defibrillator, an AED, or an automatic external defibrillator, and attach that to the patient. Then you follow directions based on how the AED interprets what's happening in the patient's heart to allow appropriate therapies. The major thing is to continue high quality CPR until certified emergency response team actually gets to the scene and can further help that patient get to the nearest hospital so that they can be revived completely. Now, the major differences that we were kind of discussing between cardiac arrest and a heart attack is, while cardiac arrest is really an electrical problem where the heart cannot conduct electricity perfectly to allow a one-to-one simultaneous conduction through the heart, and therefore is inefficient at pumping blood throughout the body. Whereas a heart attack is when the actual blood flow to the heart itself is compromised with a blockage that's usually emergent and is usually in one region of the heart. And the heart continues to pump, however, it's very compromised. So they're very different in terms of what is actually happening. Just to tie that together, sometimes heart attacks do result in cardiac arrest when they're very severe. So they can overlap. However, the major differeces are what we need to do to help these patients emergently, which is different.
There's a couple takeaways when you were talking that I thought of previous Red Couch conversations that we have had, and some of our work that we have done with the Lehigh Valley Heart Institute, and was thinking about the chest compressions and the 100 to 200 compressions per minute, and how there's different songs that they teach you to do that with, and how we've done some of these really remarkable hands-only CPR trainings as well together. I would say that that's something then that you're also encouraging people to do. And after this conversation, that would be a great follow-up is for people to reach out to you or I to figure out how to become appropriately trained in CPR, since it is such a life-saving measure.
Yeah, absolutely, Abby. I think what is really important is, and what we've tried to do over the years, I think, as a community in resuscitation, is that we are trying to make it as easy as possible and as memorable as possible to help people quickly, because in these emergent situations, every minute counts. And to be able to do that with instinct and help people without a lack of or a delay of any sort really can go a long way in preserving people's life, neurological recovery, and allowing them to survive this usually fatal thing. Cardiac arrest is not uncommon. It's over 350,000 Americans suffer cardiac arrest outside the hospital in the US yearly. That's a devastating number. And of that, only a small percentage are able to get the life-saving care that really we need emergently. Sometimes it's circumstantial, but it's also something that we can be better at always. And I think one of the major things is understanding how to effectively do high quality CPR. And I would urge anybody that is willing and able to learn through the American Heart Association has phenomenal things online, as well as events, as well as at Lehigh Valley Heart Institute.
I instantly think of Staying Alive and Baby Shark. That's where my head goes.
Exactly.
But hey, I can do compressions to either. So
right.
So when we're talking about heart attack and we're talking about how many of these episodes or incidents happen outside of a hospital, we're talking to our community here, Dr. Singh. When somebody starts having symptoms, what are we looking for and what do we do?
Correct. Yeah. So specifically now kind of changing gears to a heart attack, it's a vexing problem. And I'll say that because it's not always easy to understand what you're experiencing is truly a heart attack. And the reason is because as we start to learn more and more about this, is that subjectively, symptoms are kind of across the board. The main ones that you hear about are chest pain, pressure, tightness, squeezing in the chest or in the center of the chest, pain or discomfort in the shoulder, arm, neck or jaw. Some people have vomiting, nausea, indigestion, or heartburn, epigastric pain, sweating or diaphoresis, and then shortness of breath. All of these symptoms, which seems like everything, right, can be really synonymous with what's happening for a heart attack. And I think that's what also makes it sometimes difficult to really know. What I think in this scenario is becoming clear is that if you feel uncomfortable and the symptoms continue past a few minutes and they're sudden and they're very, new and kind of unclear, you have to remember that when you are having these symptoms, it's important to immediately seek attention to really decode what is happening. Because if it truly is a heart attack, like we know, there is a blockage in the heart artery and part of the heart tissue is actually dying. And the faster we get that open, the faster we can actually save part of the heart muscle that is compromised. So time is muscle, and we really think about the heart as a large muscle, and supplying that with oxygen-rich blood is very important. If that's compromised, we need to seek attention to get the therapies we need urgently. So I think overall, it's a difficult thing to always understand what's happening because subjectively, even men and women have different ways of expressing what they're feeling and how they're feeling, how severe it is. But that being said, nobody should really wait to understand that more. They should get help as soon as possible.
So I'm making mental notes in my head about with cardiac arrest that every minute counts and how the importance of CPR. And then now when we're talking about heart attacks, we're talking about time being muscle. See, I'm listening here.
Exactly.
So
you're
Dr.
passing the
Singh,
test.
Dr. Singh, the American Heart Association has really focused over the last 12 to 16 months on a campaign called Don't Die of Doubt. This campaign encourages people to seek medical care when an emergency strikes. So we noticed during the height of the pandemic, there was a definite decrease in people seeking medical attention due to their fears of going to a healthcare facility. What I am hearing you talk about today is how there would be potential consequences to that lack of seeking medical attention. What are some potential consequences of diminishing or doubting cardiac warning signs that we should really be aware of?
Absolutely, Abby, great question. And I think, again, this is such an important part. for people to understand that when we're talking about the heart emergencies, such as cardiac arrest, obviously, but mainly heart attacks or compromised blood flow in the arteries of the heart, this is something that cannot wait, unfortunately. It's something that has drastic consequences at a long-term event rate for people who don't get the emergent therapies, such as cardiac catheterization, which opens blockages in a very quick manner. The major consequences of waiting to come into the hospital or delaying your care during a heart attack is that part of the heart muscle is compromised, and then frankly, the tissue actually dies. This means that that part of the heart isn't going to be functioning at the normal kind of mechanism and high efficiency that other parts are. Depending on where the blockage is and how severe it is, can have drastic consequences for the heart function going forward, and sometimes forever. So even in the pandemic, we saw that people understandably were very concerned about, contracting COVID and having be exposed to COVID in a healthcare setting. We now know that although that is an understandable scenario for everyone in the community, life-saving treatments are still vitally necessary. And I think it's really important to understand, such as what the AHA has been really keen on doing, is that understanding these life-threatening symptoms are crucial for getting emergent help, even in this day and age where we have to be safe. So I think Lehigh Valley Hospital, and as well as the AHA, are making sure areas of emergency response teams and emergency rooms are safe, in that everybody has proper masking and distance requirements, and everybody has the proper attention to COVID that's necessary. And I think it's been a safe atmosphere for our patients. Now that's over a year of doing this, we've been able to treat patients safely without compromising their potential for getting COVID.
I would agree completely. And we've heard some wonderful success stories over the last year from those who did seek medical attention. So, we will continue to do our part to advise people to do just that, because, they need to be in good hands, and, those are yours. So we talked a lot of our time today about cardiac emergencies and about treatment. But the AHA, we have a strong focus here in the Lehigh Valley on working on prevention of heart disease. So let's kind of wrap things up a little bit today with you giving us some preventative measures that we could take in effort to avoid these cardiac emergencies that we've spoke of.
Absolutely. I love this. Even though my expertise is really treating blockages that already exist or fixing blockages that are there, a huge part of my clinical practice is also prevention and an interest in preventing heart disease. Because while you can't control all your heart attack risk factors, such as your age or your genetics, there are things that you can control, especially when it comes to your cholesterol, your blood pressure, your diet, your weight, being good about taking your medicines, and that combination of things. We understand that staying physically active is really important, and a sedentary lifestyle itself is a high risk for developing heart disease. The other things that you have to look for are whether you're routinely checked if you have diabetes, and if you are able to limit your alcohol consumption and do not smoke cigarettes. The other thing that is always really important, as we know, is a heart-healthy diet, a diet that's rich in vegetables, vitamins, and minerals, that avoids high saturated fats and sugary foods. I think those are the major things to help prevent heart disease. And I think if we do that as a community, we can really start to prevent these events such as heart attacks and cardiac arrest.
Well, I think for all of our viewers today that we should take note on that, and that we would rather see our native Dr. Singh in a heart healthy restaurant amongst the Lehigh Valley than have to come see you for a cardiac emergency. So I think those are good things to note.
I would love nothing more than that. I think that would be fantastic.
Well, Dr. Singh, I just want to tell you, thank you so much for joining me today. Are there any last minute thoughts that you want to add to the program, or do you believe time is muscle, every minute counts, seek medical attention? Did I get the highlights?
You definitely did, Abby. Again, this is something that I do daily, and I work on people's blockages every single day. And I think being there, understanding this, for me, comes kind of full circle to be able to talk about this outside the operating room. I think the other thing to understand, and I always tell this to patients, is that you really, at this point, even with everything going on, you have nothing to lose and everything to gain from coming and seeking attention quickly, because the major thing is understanding what you're experiencing and knowing the root cause of what's wrong, whether it's life-threatening heart attack or just, heartburn. The fact is it needs to be treated to help you feel better and make sure that you're not at risk for developing long-term complications of something much more drastic. And I always say that, the worst thing is that you come in, we find out it's not something life-threatening, you get medicines and you follow up with the doctor and you feel better. I mean, there's not much wrong with that. So if you ask me. So I think those are the major things, and always remembering to work on the prevention tips that I gave, I think really go a long way to, over the years, to prevent these things from happening.
Well, I feel like I learned a lot. I'm sure our viewers will feel the exact same way. I'm definitely going to go have a big green leafy salad for lunch. And, thank you so much again for your time today. We'll be back again in a couple months for another conversation from the Red Couch, brought to you by the American Heart Association and the Lehigh Valley Heart Institute. Thank you everyone for watching today. Thank you again, Dr. Singh. We appreciate you.
Abby. Thank you so much, Abby. It was great. And I appreciate your time and all the effort that the American Heart Association is doing for us.
Thanks. All right, all.